Chiara is going to get up and speak to us about her experience, and she fortunately has done some work with John Cole as well, who may or may not be joining us. We're still uncertain of that. So we're going to have the benefit of quite a lot of experience on her part.
Okay. Good afternoon. I'm Dr. Chiara Insalaco from Rome. Today I'm going to talk about the study that we conducted, with Dr. Cole in collaboration with my university, and to answer to some of these questions, like methodology of injections, to activate or not to activate PRP. A brief description about PRP is defined as autologous platelets concentration in small volume of plasma. Nowadays, the use of concentrated platelets in regenerative medicine is an international consolidated technique, and it faces an increase of studies and application in different medical fields. Giusti and other collaborators show that the optimal platelet concentration to promote the angiogenesis and the human endothelial cells is 1.5 million of platelets per microliter, and maybe bigger concentration of platelet can be worse. Advantages of the PRP is toxicity is an autologous medication. The pH between 6.5 6.7 inhibits the bacterial growth, induce cell proliferation, induce angiogenesis and revascularization, and stimulate the fibroblast production, plus quicken the wound healing and the scarring process. So many advantages related to the PRP. And of course, it modulates the inflammatory answer. So the PRP we done in Dr. Cole clinic, transplant group in Atlanta, in collaboration with the Tor Vergata University of Rome, is titled Comparison between two different PRP machines and two different methods of PRP activation, thanks to the support of ELISA test. So in this study, we made a comparison between two kinds of different PRP machines, Angel system and Region Lab system. Plus, we made a comparison between three kinds of activation. The most famous and most common kind of activation, calcium gluconate, no activation, many doctors use not to activate PRP, and the new kind of activation, because this study is a pioneeristic study is in this field. So the sonication, so the ultrasound machine, and so we try to activate the PRP with 15 minutes of sonication versus 30 minutes of sonication. About the region system, we drawn 24 cc of whole blood, 5 minutes centrifugation at 1,500 speed. We obtain 15 cc per each tubes, so maybe 15 cc totally, so it means 5 cc per each tubes. From the top of each tube, we drawn 2 cc of PPP, it means platelet poor plasma, and we obtain a total of 9 ml of PRP. We compare this methodology versus Angel system. Angel system, so we drawn 120 cc of whole blood, and finally we obtain 8 cc of total blood. We try to, so the advantage of the Angel system is give the possibility to obtain the PRP we want. So we change, you can change the hematocritus. So the hematocritus we wanted was 2% of hematocritus. We obtain a final PRP volume of 8 ml, so it means platelet concentration is 5.17 times. In fact, talking about the Angel system is one of the few machines to allow to prepare customized PRP formulation. So the doctor has the possibility to choose the concentration of PRP, white blood cells, red blood cells, and hematocrit, as he prefers. and is possible thanks to a system that utilizes free sensor technology. So we activated the two kind of PRP, so PRP region, PRP angel, with the different kind of activation. So sonicator of 15 minutes, sonicator 30 minutes, 1 ml of PRP incubated with calcium gluconate 10% at room temperature for 10 minutes. And another part of PRP was not activated. We use this, of course, the ELASA test. So the PRP samples were added on a microplate with 96 cells pre-treated with an antibody against the growth factor we want to measure. This one is the result we obtain. In the white part, we have the PRP produced with the region lab device, and the yellow part, we have a PRP produced with Angel system. What we can see, so we study EGF, transforming growth factor beta, PDGF, and VEGF. So these one are the growth factor we studied. And what we can see, the different kind of concentration we obtain with the different two machines. And what is outstanding, how the growth factors level are much higher with the Angel system device and lower with the region lab device. And also the difference between the different four kind of activation. In this case, it looks like that Angel plus 30 minutes of sonication gave us the best, the highest level of growth factor. One of the most important is VEGF. So the vascular endothelial growth factor with 1,630 picogram per ml. Compare, for example, with the region 30 minutes sonication is just 381. Here the result I explained before. So this one we concluded in this way the first part about different kind of activation and the machine. We can see how the PRP is all non-PRP are the same, so they change from device to device and activation by activation. Still we don't know. We can't speak about international and objective protocol. Now about the methodology of activation, of injection the PRP. Studied, quindi showed that through the antibody anti-cytokeratin marker, we know that the bulge stem cell that we want to activate, where we have stem cell, are located between 1 to a millimeter depth, and the mean length of scalp follicle is 4.16 millimeter. So the injection of the PRP should be, we want to be close to the bulge area, so it could be around 3 millimeters. So we had to try to be precise about that. The kind of injection, there is the most common injection is by needle, so using the needle. So with the 1 ml Luer lock syringe using a 30 gauge needle, I used to inject 0.1 ml per square centimeter at 3 millimeter depth. Another methodology, more recent, is one of the mesotherapy gun, is one of the many we have in the market. The advantages of this machine is doesn't give any pain to the patient, is universal, it means that accept every kind of needle you want to use, user-friendly, so there is a sensitive managed of control where you can set the depth, can be from 1 to 13 millimeter, and the dose from 0.01 ml to infinity. Disadvantages, of course, is the cost and the time consuming, so it takes a little bit longer using this machine. What I do in my daily practice, not all patients are the same, so in particular the reaction toward the injection can be different. The only solution is to give a pre-PRP local anesthesia injection, but many of the patients find it also a traumatic experience. So what I did with my pharmacist, we collaborate with, we created a local cream anesthesia compound. I used to put on the scalp of the patient at least for 15 minutes, and after that I go with the PRP. The patient is comfortable, so he doesn't feel any pain, both from local anesthesia and from PRP injection. Okay, thank you for your... So now, I'm not the moderator of this session. This is my experience. It doesn't mean that it has to be this one the way to produce PRP or activate PRP. We did a very reliable study, so what I show, they were numbers, so it's something that we can trust on. But I want to ask also to my colleague their experience about activation, no activation, depth of injection PRP. So, Dr. Unger.
Okay. So I do not currently activate my PRP with anything, but I do a fairly aggressive microneedling prior to the injection of the PRP, which I believe provides an in vivo activation. When I say fairly aggressive, in a woman, I'm doing it to the depth of 1 to 1.5, and men usually 1.5 to 2, depending on the thickness of the scalp.
Okay, thank you. About other colleagues, Dr. Gupta, you have any experience that you want to share with us?
With us at the moment, the microneedling that we use is really the injection process itself, which I think activates the PRP. And when we do transplants, we inject it before we make the sites, and then we believe the site making causes the injury.
Okay. Dr. Cole, we did the study together, but I want your opinion.
Well, you know, first of all, I like what Robin's doing, and the microneedling alone is going to turn things on. We know that not activated PRP works. We've studied it, and it doesn't work quite as well, but it does work. There's no question what she's doing is functional. In regard to what I do, I'm well beyond activation. You know, I liberate everything.
Yeah, we just presented before you got here, John, the work that you did with the Italian group and studying the two protocols looking at the different growth factors. That's a pretty impressive study, and I thought it was very well done. But it shows you how confusing and how easy it is not to know what it is that you're putting in.
So I think that's a really important point that Carlos is making. So I've had patients come to me and say, I want a hair transplant because I tried PRP at Dr. So-and-so's, it didn't work for me. Now, it may be true. Maybe they got a really good PRP protocol, it just didn't work for them. Or maybe they got something that had a platelet concentration of 1.4 times normal blood with no activation, and it was basically like injecting blood back into the scalp without much role.
Consider the study we did. We studied the concentration, the level of growth factors. So it doesn't mean that all patients are going to respond in the same way to all this kind of activation and machine. But these one are the growth factors numbers we obtain from the study. So the clinical result can be different.